Hi, I'm Tammy from Insight HR, and today I'm talking to you on drug and alcohol policies, what you can and can't do as a manager. Drug and alcohol is obviously a really important issue in the workplace, and employers have a duty of care to provide a healthy and safe workplace for visitors and for their staff. So it's really risky if you think someone is maybe affected by drugs or alcohol, and you need to know the appropriate way to deal with it. What I always recommend in your policies is that you write in that when an employee presents for work that they in an unfit state due to drugs or alcohol, that you reserve the right to seek a medical opinion and to remove them from the workplace. This is just good practice to make sure you have got an out if you seriously need to have someone looked at in relation to drugs or alcohol. What an unfit state means can vary depending on the risk of the activity that they're undertaking. What you might think is unfit in an office environment will be different if they're driving machinery or forklifts. Unfit, you might decide, is just not worth taking the risk if you do believe them to be under the influence of drugs or alcohol if they're operating machinery. So you can decide that on your own accord. There was a recent case where an employer did dismiss an employee based on the assumption that they were on drugs, marijuana. But what had happened was the employee had had marijuana the night before, and they were just hanging around in the tea room with an employee who was well known to be a drug user, and so the employer just extended that thought that this employee must be on drugs and dismissed them. And when the test came back, it found that there was very little marijuana in their system, and the employer had to pay a lot in compensation to that employee. So just be wary of making these bold statements and make sure that you handle this issue with sensitivity. There are 5 key things to note when you're handling a drug and alcohol issue. You need to have a clear procedure to follow, and you need your managers trained in that procedure, because you might not think you're going to have to ever deal with a drug and alcohol issue, but on the day that you do, you're going to be relying on clear process to talk your managers through the process, or else people's emotions take charge, and there's often people that are just terminated on the spot due to a thought that they might be affected by drug and alcohol issues, and it's actually not correct. So you just need to be careful that you've got a clear process in place. This is what we do as to handle a drug and alcohol issue. You need to keep notes of all conversations and with witnesses as well, to keep them as evidence. If you do end up terminating someone, you want to have a clear history of evidence there. You don't want to take any chances when it involves risky activity, so forklift driving, etc. does bode well to have maybe an assumption that someone is on drugs and alcohol and just stand them down from that task. You might move them to another task even if you don't do anything further, but make sure you keep that evidence and log it. And also extend that expectation to the company car policy. You want to make sure that when they've got the company car over the weekend, that they're also abiding by the road laws, which include drug and alcohol influence. So make sure you've written that into your company car policy. You can actually ask a medical practitioner to drug test with the consent of the employee. Now, getting the consent of someone who perhaps is drug affected might be difficult, but you do have the right to do that. Of course, any information that is obtained must be kept highly confidential, and that's one area that you cannot afford to leak out into the organisation. So you can, if you're worried and you think someone's really overstepped the mark, you can give them a first and final warning, as long as you've got a clearly documented procedure for how you handle a first and final warning, and make sure that you follow that correctly. And there is one of those on the HR shed if you do get stuck. You may want to also link that policy into your code of conduct when you have a new employee start. Make sure that they've signed off on the code of conduct, which also mentions your drug and alcohol policy. So if you want a full suite of great policies and procedures that help your business run smoothly and help you tackle those difficult tasks, including handling drug and alcohol affected employees, go to the HR Shed. We've got over 12 years of experience developing these policies and procedures to work in every industry and in accordance with legislation. And you also get free email support and all the processes, tools, templates you could possibly ever want or need to manage HR and OH&S in your business.